Okay, so here we have Motherwort. Now this is one we really should be keying because it's got a completely different kind of flower than what you're used to. But we won't because
you already told us what it is.
well, no, really, it's still worth going through the exercise, but really it's more about, did I just kill a mosquito? Sorry if I did. It's more about the fact that, unfortunately, there's only one of them, and it would be kind of hard for everybody to gather around. Okay, so Motherwort is from the mint family. Remember, mint family plants the mint family is one of the families of plants that the plants usually have square stems and opposite leaves, and the flowers are usually either in a whorl like this, in a circular pattern around the leaf axils, or they're in a spike or head. In the case of wild bergamot, which is also from the mint family, they're in a head. So Motherwort is, it's really a plant of transition areas like this. Technically this is a forest, but it's more like a transition area because we're in a pine forest and there's still a fair bit of light getting down to the forest floor. It can grow in more open areas, but it usually doesn't do that well in open areas, except in years like this one, where there's a lot of cloud and rain. Okay, but this is very nice, it's very lush. When the leaves first come up, when we saw it last time, they look like this, down below. The leaf it looks like the leaf of a silver maple. But then as it gets taller and more mature, the leaves become narrower and sharper and more sharply three-lobed, so that they look like this, like a bird's foot or something. And the time that you want to harvest it is in the first week or so after it goes into flower, when it's still transitioning from the broader, more maple leaf-like leaves to the narrower, sharper leaves. And this one is at the perfect stage for harvesting. I mean, it's perfect. You know, if you could find a whole field, not a field, a whole transition area with many plants that look like this, you're styling as far as harvesting Motherwort is concerned. Now the flowers are kind of interesting. They look like, I don't know, like little weird creature faces. And they grow, as I said, in a whorl around the axils. You know, this one would have been the first one to go in flower right here. And they continue to flower as it grows. And you can see this one's only got one. These guys are still budding as it moves up. And the flowers will move up the stalk as it grows. You want to harvest about, like if I was harvesting this one, I would be harvesting about the top, less than half, maybe 40% of the plant, like maybe there. And we do need to remove the stalk. Now, a word of caution. The bracts that surround the flowers on this plant have little sharp spines, and they can penetrate even through your fingertips where you've got thicker skin. They are quite prickly, and they can not only prickle you when you harvest them, but unfortunately, like so many other plants, the vast majority, we need to strip off a lot of the stalk. So we need to strip the flowers and leaves and bracts. Like if I harvested it here, I'd be stripping it from about there. You want to strip it pretty much from the point on the stem where the stem starts to become more rigid, which is about here. As you go higher, it's more flexible. So where the stem is still fairly soft and succulent and not so rigid, that section you can use the stalk. But below that, it is not potent enough. So you need to take your hands and go off of it, and it will really jab into your fingers. I don't mind it so much. I find that if I'm a little bit careful and gentle with it, it doesn't prick me too much. But if you're concerned about that, then you're looking at wanting to use latex gloves. And I mean the kind of latex gloves that you use for cleaning, not the kind like surgical gloves. Those surgical gloves would be too thin. It would go right through. Hands are off limits. You know that. Okay, so let's talk about its properties, and we'll give you the long version again because we're close. We're at the time when you would harvest it. Where I am, it's a little bit further along. I didn't need any this year because I got a lot a couple of years ago, and I got a lot a couple of years ago, and I'm still doing okay with it. But had I harvested it, I would have probably harvested it about a week to 10 days ago, where I am. This, though, is perfect. Okay, so first of all, it is a nervous system herb. And a lot of what I said about St. John's wort applies here, except that this one doesn't have the profound ability to heal damaged nerve tissue the way St. John's wort does. But it's a tranquilizing herb. It's calming. It reduces stress and anxiety. It helps with tension headaches. It calms, it helps with tension in the body. It's also very good for depression. And this one works well with St. John's wort for depression as well. Secondly, it is a very important herb for the cardiovascular system. Okay, so it's a good heart tonic. It improves the peripheral circulation, and it's somewhat healing and anti-inflammatory to the blood vessels. So it's used in virtually any kind of cardiovascular condition, but because there's a kind of an overlap between its effects on the nervous system and its effects on the cardiovascular system. It's a specific for nervous palpitations, nervous heart palpitations. Heart palpitations due to stress, anxiety. It's also good for other types of heart arrhythmias as well. The third major area that it works really well is on the reproductive system, the female reproductive system. And in the case of the female reproductive system, it's another one that's a tonic. Okay, so that means it regulates and normalizes the menstrual cycle. So it can be used for virtually any type of female reproductive issue. Irregular periods, menstrual cramps, absent periods, light bleeding, heavy bleeding, PMS, you name it. And again, because we've got this overlap here between reproductive effects and nervous system effects, it's especially good where, herbs that work on multiple systems are usually especially good where they overlap. So if you've got anxiety, mood swings, depression related to the menstrual cycle, with a hormonal component, it's a specific for that. It's also a specific for heart palpitations that are hormonal in nature, like heart palpitations due to menopause, for instance. It's also a good digestive herb for functional digestive conditions. It's only mildly aromatic, very, very slightly aromatic, but it's pretty bitter. Now, the more mature it is, the less bitter it is. So if we harvested it later in its flowering period, if we mostly harvested the top thinner leaves, it's less bitter. If you harvest it earlier and you mostly harvest the more maple leaf-like leaves, it's a lot more bitter. But typically it's a moderately bitter herb. And that helps with liver and gallbladder conditions, indigestion. any other sort of digestive dysfunctions. Not as, because it's less aromatic, it's not as good for gas and bloating. For respiratory conditions, it's got a few benefits. It dries the sinuses for runny nose. It's very good for lowering fever. And it's somewhat relaxing to the lungs and helps a little bit for bronchial constriction. It's probably antiviral. I don't know. There's not very much research done on this herb, so it's hard to say. I can't remember if anybody's come up with antiviral properties, but it wouldn't surprise me if it's antiviral properties because I've talked to you about this before, just as immune stimulant properties are pretty much ubiquitous in the aster family, antiviral properties are pretty much ubiquitous in the mint family. It's a fairly good neural vasodilator, so it helps with dementias and neurological conditions. In addition, of course, to the fact that it already has a significant effect on the nervous system. And miss anything? That pretty much covers it, most of it. Can't think of anything else offhand. Because of its bitterness, you wouldn't want to use it. Ideally, again, it's not. You typically would use it in the 20 to 25% range, and unless you pick it a little bit later in its flowering period, in the 20 to 25% range, it would be bitter enough that you wouldn't want to put any other bitter herbs in your formula. But you definitely don't want to go higher than 50%, or your formula is going to be too bitter. The one other thing I wanted to mention, I knew there was something I was missing. It's another herb that I use in pregnancy. But this one we only use in the last trimester. Particularly in the last month of pregnancy. If you could be using something like raspberry all through the pregnancy to help strengthen the uterus, but this one comes in the last month of pregnancy where it really helps to prepare the last final stages of preparing the uterus for childbirth. It's also very, very good during labor as well, to speed up the labor, to increase the intensity of contractions, and especially to help with dilation of the cervix. So a great herb to use in the last month of pregnancy, during labor, and in the first month after the birth, where it helps a lot with postpartum depression, and it also helps the uterus to shrink back to its normal size. So use with caution in the first 2 trimesters of pregnancy. And outside of the way I mentioned using it, I wouldn't, beyond about the first month after birth, even the first few weeks, I probably would say use with caution during lactation as well. And that has more to do with its bitterness. Bitter herbs can sometimes, indirectly through the mother, throw off the child's digestive system a little bit. And it is a soma herb. So use with caution if taken concurrently with sedatives, oral contraceptives, mood-altering, and anticonvulsant medications. Any questions on Motherwort?
When you're saying in the last trimester in the month after birth, would you take that in like a chronic protocol?
Yeah,
And what about during labor? Would that be acute?
that would be more acute, yeah. But really, it's not really the last trimester, it's really more the last month.
Last month.
Any other questions?
I think you kind of touched on it last time, but it has an effect on the thyroid, right? Or
Oh yeah, that's right. I forgot about that. Thanks for reminding me that. It does have a mild kind of suppressing effect on the thyroid, and for that reason, it can be used in hyperthyroid, where it helps not only just to suppress lower the thyroid function a bit, but a lot of its other symptoms, a lot of its other indications are symptoms that are commonly associated with hyperthyroid, like anxiety, heart palpitations, and stuff like that. Now, keep in mind that the mint family herbs like this one and Lycopus, bugleweed, that are used for treating overactive thyroid, they don't actually heal the thyroid. They interfere with thyroid hormone production. So they're not a long-term solution. They're just a short-term help. Okay? So for that reason, you would probably want to use it with caution if you have hypothyroid. But I have found that, typically using it the way I use it in formulations at 20 to 25%, that it usually isn't a problem, unless you combine it with other thyroid-suppressing herbs. Any other questions?
Would this be a common herb in your practice?
I use a lot. I mean, I don't use a huge amount. It's moderate. Okay, so in my practice, the herbs I use very little of would be like a half a liter to a liter a year, right? Then the moderate herbs, I'm typically using maybe 3 to 5 liters a year. I say 3 to 4 liters a year. And then with the herbs I use a lot, it's more like, 5 to 8 liters a year.
And that's a 1 to 5 usually that we're talking about?
Yeah. Keep in mind that I have about 150 herbs available to me, about 100 of which that I use regularly, and I only see clients 1 day a week. So you can imagine the kind of quantities I'm using, right? Now that being said, I should point out though that I also have every second Saturday a student clinic. So that's using up tinctures as well. Although the students have to make some of the tinctures that they're using. But still, so like, maybe it's more like, what I'm using up is more like 1.5 days a week. And when you take into account the student clinic. Anyway. All right, any other questions? Okay.